The Delta State Contributory Health Commission has organized training for private healthcare providers involved in its health insurance scheme on how best to implement the Commission's new policy. The healthcare providers, under the aegis of the Association of Nigeria Private Medical Practitioners (ANPMP), were trained at the Commission's headquarters in Asaba, the Delta State capital, with the aim of improving the quality of healthcare services rendered to enrollees of the state health insurance scheme. The chairman of the commission, Dr. Austin Obidi, said the role of private medical practitioners remained critical in the actualization of the vision of the scheme and urged them to join hands with the commission to improve the quality of healthcare services they rendered to enrollees of the scheme.
You in private facilities, you are not playing a small role, rather you are playing a very major role in making the health insurance scheme in Delta work, so that together we give our people quality health care. That is 2025, the quality of care our patients will get will be better than what they got in the past.
The Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, said Governor Sheriff Oborevwori had released funds to cater for pregnant women from conception till delivery and for children under 5 years under the Equity Plan, noting that Delta State is the only state in the country running the Equity Plan. Dr. Akpoveta, who lectured on organization developmental stages, mathematics of capitation, bundle payment concept mechanism, as well as policy document and tariff, noted that the Commission was training healthcare facilities under its scheme in groups to equip them with the requisite knowledge and skills required to implement the updated policy of the Commission. He reiterated that everyone resident in Delta State, irrespective of tribe, were entitled to benefit from the state's insurance scheme, adding, however, that any pregnant woman who failed to avail herself for the free registration with the Commission and had not attended clinics in the state for at least 6 antenatal care would be required to pay to access care in any healthcare facility.
Also on record that we certainly have released money for the equity, 1 billion and then 100 million every month for the equity. And equity means pregnant women from the day of pregnancy till they deliver, either by normal delivery, continuous delivery, or cesarean section. So, antenatal patients should register. Registration is free. Under 5 to register, it is free. And then with that card, you access care. If you are a resident of Delta, you are from a neighboring state, and you are resident in Delta State, we have no problem with you. As long as you're in Delta State, you do your business here, you pay your tax here, it means that you're adding to the development of Delta State. So Delta State can care for you. But when you live in another state until you're about to deliver and you rush to Delta, that is cheat, that is fraud. That should stop. And that is why we've introduced that if you are not registered and haven't attended clinic in Delta for at least 6 antenatal care, if you come here pretending to be Delta resident, you may have to pay.
Some of the participants, comprising medical directors, pharmacists, pharmacy technicians, and medical officials who came from different parts of the state, commended the Commission for the interactive training and promised to put the knowledge gained into good use.
We are not in doubt that the Commission originally met well, and I'm also certain that some of the challenges are genuine. The goal is to see that we are on the same page. At least it's a sign of the Commission's willingness to continue collaboration with providers.
The improved EMR system that they are using now is better than what we're using before. So there's new facial recognition. At least that one erases the fact that we need to sign, patients need to sign on their attendance sheets, and we have to travel every month to bring it back. And thank you for the new improvements.
Eunice Emiazia
Goal is to see that we are on the same page.
reporting.